You can't argue with the passion our next nurse has for her career choice. Registered nurse Sandra Hishida can relate better than anyone with the patients she serves every day.
Clinical wound nurses treat a wide variety of wounds and burns. These injuries are extremely painful, and the healing process can be very slow.
My name is Sandra Hishida. I've been a nurse for about 20 years, and I work at Community Regional Outpatient Burn Clinic. Hey, can you meet me near the staff room and find your brother?
Sandra is a native of California's Central Valley and can't imagine raising her children anywhere else.
I have a daughter named Cassandra. She's 14, a freshman in high school. And my son, his name is Shoji, and he's 12, and he's a sixth grader.
I think dogs are supposed to have their fur.
Sandra is especially sensitive to her children's needs,
You ready?
as well as her injured patients. Sandra is a burn survivor herself.
Well, I was in a house fire when I was 7 years old. We don't know what caused the fire, but it was an attic fire, like at 3 in the morning. And myself and my 3 older brothers were injured in this house fire. And ultimately they didn't survive, so I ended up being the only child after this house fire. I was at 40% third-degree burns to my face, hands, back, feet. And my biggest problem is that I had severe smoke inhalation, so I have this raspy voice. And I used to have a high-pitched voice, probably a singing voice for American Idol. So we kind of have a tight little walk. We're going to go through this office right over here.
During this busy shift, she is juggling 3 patients in need of her medical care. This man, a diabetic suffering from neuropathy or a lack of feeling in the hands and feet, severely burned his toes while running his bath water.
I didn't even notice that he was burnt until I picked up my foot and I saw all that skin hanging there.
Having diabetes significantly increases his risk of having complications from the burn. Diabetes can compromise circulation, so Sandra is very concerned about an infection or even worse, the need for an amputation.
Because you're diabetic, all the skin that's dry puts you at risk for like cracks and different things. You can get an infection there.
Next door, another patient, Mr. Hall, is battling a nasty bout of cellulitis, a serious bacterial skin infection.
Yeah, it looks really irritated.
If left untreated, the infection can rapidly turn life-threatening. Sandra applies antifungal cream to soothe the itching and prevent a yeast infection.
Is all this itchy?
Pretty itchy up in here.
Sandra also uses calcium alginate, an antibacterial medicine, to prevent infection.
This is really good for absorption too. It's that alginate. So I'm going to use that today. So where's your pick one?
Right here, am I right on the...
Okay.
For some patients, recovering from a severe burn can take years. This young man has burns over his entire body, wounds that were once life-threatening. He spent several months in the hospital and is now being treated as an outpatient.
It's funny, sometimes you feel like you can't wait to go home, and then all of a sudden you get to go home and it's like, ooh, where's my nurses?
His pain is still so severe, Sandra must administer fentanyl for pain relief.
Are you able to take steps? Okay. Very good. I love my job. I absolutely love my job. I can't really imagine doing anything else now.
We're glad you're not doing anything else either. We're sure your patients feel the same way.